Okay. Well, Joe's going to be doing some physical exam stuff, and I'm going to be asking you some questions to better get an idea of what your pain's like, okay?
Okay.
All right. How long has your pain been going on for?
It just started this earlier, a couple hours ago.
Okay.
Mr. Cash, can you look straight up, please?
Is anything making your pain feel better or worse?
I just don't want to move around. I just want to sit still.
Okay. Yeah, keep lying very still then. Where exactly is your pain located?
It's right here.
Okay, we have substernal chest pain.
Yeah, it goes to my back. And,
Goes to your back.
Yeah, and it got really bad this afternoon, and I passed out. And then I
Okay.
woke up and called you guys.
Okay. And is the pain radiating anywhere besides your back?
No.
Nowhere besides the back.
Mm-mm.
Okay. And it seems like you're in pretty severe pain.
Yeah.
If you could rate it on a scale of 1 to 10, 10 being the worst, where would you rate it?
10 at
Okay.
least.
So, in the timing of your pain, has it been consistently painful since you woke up from that syncope episode?
Yeah, it's just been getting worse since
Okay.
a couple hours ago.
Mr. Cash, can you smile, frown, puff out your cheeks, raise your eyebrows, close your eyes, don't let me open them. Good. Can you shrug your shoulders, please? Good.
Okay. Well, we want to get something for some pain control, but first I want to see what medications you're on.
Okay.
Do you take any medications with you? Or do you
Yeah,
have a list of
I
them?
got a list here somewhere. It's in my wallet here.
Okay, I'll
Mr.
take
Cash,
a look at
Can you
these
open your mouth, please, and say,
medications.
ah?
All right.
Good.
So what we have here is, just to list them off, atenolol, lisinopril, doxazosin, glyburide, Lasix with potassium, and Plavix. So it's clear we're dealing with probably some hypertension, some diabetes. Mr. Cash, have you been pretty compliant with taking these medications?
You know, I try, but the old lady died, a couple years ago, and she was the one that always reminded me, and I can't remember half the time.
Okay, we'll need to do maybe some medication education for you.
Can I get some pain meds?
Okay, we'll get on that.
All right.
Mr. Cash, can
As
you
far
breathe
as
through
you
your
know,
mouth, please?
do you have any drug allergies?
I don't know. I haven't taken all the drugs that there is. So
Okay,
how the
but
hell should I know?
You've never had an adverse reaction to anything
No,
you've taken?
no.
Okay. Okay, nurse, we want to get him started on some morphine, 2
Mm.
mgs via a slow IV push. We want to concurrently monitor his blood pressure and administer a fluid challenge as
Just
needed.
relax.
Also consider the need for dopamine or a vasopressor, but try to manage with the fluid challenge only. We also want to order some labs, CBC, CMP, coags, cardiac enzymes, BUN creatinine, amylase lipase, also a type and cross in case he needs a transfusion. We also want to get him a portable chest x-ray. We want AP and lateral views. Okay, Mr. Cash, how is your pain control now?
It's better with that
Okay.
morphine. It feels a little bit better. It still hurts, but it's
Okay.
more tolerable.
Well, we'll keep managing that pain for you, make sure it's tolerable. With your past medical history, do you have any chronic diseases or conditions we should be aware of?
I got high blood pressure. I got something with some artery disease in my legs
Okay,
and arms.
peripheral artery
That
disease.
sounds about right.
Okay.
And I got the sugars and
Diabetes.
something. Doc says my prostate's enlarged or something
Okay.
like that.
Okay, BPH.
Okay.
All right. And then, is that all we need to be aware
I
of?
think so.
Okay.
I think so.
And have you had any surgical procedures?
I had a bypass in my leg from that artery disease,
Mm-hmm.
and then I got a scar right here. I'm not sure what
Did you
that
have your
was.
appendix taken out?
That sounds about right. Yeah.
An appendectomy. Was that
Yeah.
recent or were you
Oh,
younger?
that was when I was a kid.
When you were a kid.
Mr.
Okay.
Cash, can you wiggle your toes, please? Good. Can you tell me if you feel anything and which leg you feel? Which
Okay.
leg you feel it on?
Yeah. Feel that.
Okay, which
on
leg
my
is
right.
it? Good.
That's on the left.
Good.
Do you have any diseases or conditions that run in your family at all?
My mama died from stroke, and my daddy died from a heart attack, and both of them had the sugars also.
Oh dear. Okay, that's a pretty considerable family history then. Did you or do you still use tobacco products?
I used to smoke all the time, and 2 packs a day or so,
Oh
and
my.
then
Okay.
I'd smoke a cigar every once in a while now, but I quit the cigarettes.
Okay. Do you use alcohol products at all?
Every once in a while, I drink for anytime I have any pain. I'll drink some of my moonshine that I
Your
make.
moonshine.
Mhm.
Oh, okay. We'll have
Yeah.
to talk about that maybe a little bit. You said you're a widower. Do you live alone then?
Yeah, the old lady died a couple years ago, and so I've just been living by myself. So.
Okay. All right. Well, thank you for filling us in on those details.
Okay.
Joe's just going to finish up with the physical exam, and then we'll have a little talk.
Okay.
Thanks.
Thank you.